Defiance Studios, in collaboration with Defiance Press and Publishing, is proud to present a deep dive conversation into Candace Esham's best-selling book, Locked Out, published by Defiance Press and Publishing. Let's join now.
Okay, let's dive into a story today. It's both heartbreaking and honestly pretty inspiring. Imagine a woman named Mary Claudia Jones Barthelme. Everyone called her Memom. She sounds like she was just a real shining light, always saw the best in people. And she found her calling as a nurse. For 17 years, she dedicated herself to caring for residents. Many were in a place some saw as a last resort, but not Memom. To her, every single person was family.
That's right. And today we're taking a deep dive into excerpts from this really powerful book, Locked Out, Elder Neglect and the Keys to Change. It shares one family's just devastating experience.
And our mission here is to really unpack that journey for you. The neglect of the assisted living facility, yes, but also, crucially, how that family turned their grief into this relentless fight for systemic change.
Yeah, we want to pull out the key lessons, things about advocacy, the absolute need for transparency in elder care, and, what it actually takes to improve the lives of our seniors.
So let's start with Memom herself. Who was she? Mary Claudia Jones Barthelme, born 1924, on a sharecropper farm down in Georgia. Life threw challenges at her early. She lost her mother when she was only 3, but she was raised by her father and this beloved grandmother who, the book says, instilled this deep faith, strength, and a real sense of joy.
Mm-hmm. And even though they didn't have much money, she apparently often said her family was rich. Rich because they had an abundance of food, warmth, and love. I love that quote.
That's beautiful.
Her path to nursing, it almost sounds like fate. She was at Toco Falls Institute, part of a National Youth Administration program, working near a woodworking shop. And, guys would get cuts or splinters.
Happens all the time at a wood shop.
Right. And she was the one patching them up. And something just clicked for her then. Later, during World War II, she saw an ad for the cadet nurse program at Emory University. It offered free tuition if you committed to serve after graduation. She saw the need, knew she couldn't afford school otherwise.
And just went for it.
Pretty much. Her aunts apparently told her she'd never make it, which, just fueled her fire.
Sometimes that's the best motivation.
Totally. The book says she scheduled a taxi for 6:30 in the morning and just never looked back. And get this, her thesis, way back then, was on community-based care in rural areas.
Wow. An issue we are absolutely still talking about today.
Isn't that something?
So, life continues. At Emory, she meets her first husband, Richard. Navy pre-med program. They married in 46. But sadly, Richard had Hodgkin's disease. It had been in remission, but it came back, and he passed away just 2 years later in 1948.
Such a loss. Years later, she met her second husband, Walt Jones, who was a WWII pilot.
How did they meet?
Playing tennis. And the story is she actually wrote her phone number for him on a napkin with her lipstick.
Love it. That's classic.
Right. They married in 52, spent some time in Hawaii, came back with their daughter, Lucilla, who's the author's mom.
Okay, so life moves on, but nursing calls her back.
It does. At age 50, Memom decides to renew her nursing license. She goes to work at the hospital for the chronically ill in Smyrna, and like you said, it was often called a facility of last resort, people who had nowhere else to go. But Memom, she brought such compassion, treated every single patient with incredible care, kindness, made sure no one died alone.
That's dedication.
Oh, absolutely. She celebrated holidays with them, birthdays, anniversaries. It was all part of the care for her. The book really emphasizes her legacy. That beautiful smile, her selflessness, that positive outlook.
So fast forward again, her third husband, Albert Barthelme, passed away in 2014. And after that, Memom decided to move into assisted living.
Yeah, and it sounds like a very conscious choice. She really valued her independence, but she was also practical. Knew she'd eventually need help, getting dressed, meals, showers, that sort of thing.
And the family supported her.
They did. They researched places, found one with seemingly good reviews, and helped her make the move.
So before things changed, what was life like for her there?
Well, according to the book, it actually sounded pretty good initially. She loved being around people, playing games, which was apparently a bit of fun for her after a stricter upbringing where games weren't really allowed.
A little rebellion.
Exactly. She loved the social events, especially the ones Kyla, the life enrichment coordinator, planned. Things like holiday parties, pumpkin decorating, often in the bistro area. Family was encouraged to come.
That sounds nice and active.
It does. She was popular too, voted resident ambassador. There's even a picture mentioned of her portrait in the bistro with her golden noodle, Carter.
Ah, dog.
Yeah, Memom and Carter were apparently quite the pair, very popular visitors. One resident even used to keep bacon aside just for Carter.
Okay, that's adorable. So,
Yeah.
a vibrant life, engaged, connected.
Right. It really paints a picture of someone thriving in that social environment.
And then early 2020 hits. The world changes. The pandemic arrives. The initial plan for facilities was, what, a 2-week lockdown just to stop the spread?
That was the idea, yeah. And remember, each state governor had a lot of authority to manage the public health emergency in their state. It wasn't uniform.
Right. And pretty quickly, we started hearing about really alarming death rates in long-term care facilities across the country.
Devastatingly high. And the source we're looking at, the book, it highlights a specific set of decisions made by governors in several states: New York, New Jersey, Pennsylvania, Michigan. These became really controversial. They issued orders that required nursing homes and other long-term care facilities to readmit hospital patients who had tested positive for COVID, even if they were still positive.
Even if they were still infectious.
Yes. The New York order from March 25th, 2020 is specifically mentioned. It explicitly said facilities could not deny readmission solely based on a COVID diagnosis, confirmed or suspected.
Wow. And the book notes that the Department of Justice actually launched an investigation into these decisions later on, right? Under the Civil Rights of Institutionalized Persons Act.
That's correct. It factually reports on this investigation, mentioning how the DOJ compared death rates per million residents and total deaths. It contrasts states like New York and New Jersey with places like Texas and Florida. The source points out that Texas and Florida, despite having larger populations and more total cases than New York, actually had lower death rates per million residents in these facilities.
So the feds were looking into why these policies in certain states might have led to worse outcomes.
Exactly. And what this whole situation really threw into sharp relief was how decentralized elder care oversight is in the U.S., especially for assisted living, which is mostly regulated at the state level.
Right, not like nursing homes, which have more federal oversight.
Precisely. So the different ways states handled the pandemic, these readmission orders, it had direct, sometimes tragic consequences inside facilities. That's a huge takeaway right there. State policy decisions mattered immensely.
Absolutely. And even before the full lockdowns really clamped down on Memom's facility, the book mentions some early warning signs about the care she was receiving.
Yeah, there was an incident involving a foot wound Memom had even before the pandemic chaos. A state investigator looked into it, but Memom herself didn't want to pursue it. The family suspected, she was afraid of retaliation from the staff.
Or just didn't want to leave her friends.
Both, probably. She didn't want to leave her friends or cause trouble. It's a small detail, but it really speaks volumes about the power dynamic, doesn't it? Residents can feel incredibly vulnerable.
Definitely. So things really start to escalate after Memom has a fall, an injurious fall. She comes back to the assisted living facility on September 3rd, 2020.
Right. And that fall was reported to the state complaint system, like it's supposed to be. But the family says they never heard anything back. No information about any investigation into that fall. Another red flag, you could say.
Yeah, communication breakdown number 1.
And after she got back from the hospital stay for the fall injury, that's when the visits became extremely restrictive. The book describes them as feeling almost punitive. Limited to just 30 minutes, supervised porch visits only. You had to make an appointment. And there's this one really upsetting incident described where Memom was late for her scheduled visit because, she was still recovering from her fall, moving slowly. And the attendant reportedly just cut the visit short, said, "You have 12 minutes.
Oh, that's just harsh. 12 minutes.
12 minutes. The source points out there was no clear scientific reason for that rigidity, especially since no one else was waiting. It just felt controlling. And having that mandatory staff attendant there, it completely killed any chance for private conversation between Memom and her family.
Awful. Just desperate to connect, and you get that.
Exactly. And this wasn't the only issue with visits. The author calls another incident the second sign. This was in October 2020. A facility nurse told the family they couldn't visit at all because of the governor's orders.
But that wasn't true.
Well, the family checked around. They had healthcare friends in the area who said other places were allowing visits. So they called the Delaware COVID hotline. The hotline confirmed, yes, the state was allowing outdoor visits. But, and this is key, private facilities could set stricter rules based on their corporate policy.
Ah, so the facility was blaming the state?
When it was actually their own corporate policy, or maybe even stricter than corporate policy. The book notes that the corporate policy itself didn't even mandate isolating residents who tested negative just because someone else in the building tested positive.
So they were using misleading information, imposing rules stricter than the state, and possibly their own corporate guidelines. That really points to a lack of transparency, doesn't it?
Huge lack of transparency. And while all this was happening with the visits, there were growing worries about Memom's condition, both mentally and physically. Facility notes from August 2020 mentioned Memom was seeing people in her apartment, hallucinating.
Oh dear, what did they do?
An external nursing agency followed up. Her lab work came back normal. But their documented solution for the hallucinations was, well, it was just to close her blinds earlier in the day.
Close the blinds.
Yeah.
That was the intervention.
That's what the source describes. The author talks about seeing Memom's room looking dark when they used their ViewClicks video chat, and seeing her sleeping in her recliner all the time, which was completely out of character for her before the isolation.
So she's clearly declining.
Seems like it. And the facility director apparently told the family that Memom wouldn't benefit from mental health services, kind of reinforcing this close the blinds approach. It suggests maybe staff weren't equipped or didn't have the resources to handle what was happening, and the family couldn't really step in effectively.
It sounds like they were being shut out more and more. They couldn't see her properly, couldn't assess that earlier foot wound themselves, couldn't go to doctor's appointments with her.
Totally shut out. The book says they hadn't been physically close to her, like within a few feet, since that awful incident on the porch back on December 1st, the one where they were yelled at after complaining about the visitation rules to corporate.
Just awful. So they're desperate.
Completely. It led to them trying to figure out how to get her out. On January 19th, 2021, the author describes calling her uncle. He held the legal power of attorney, the POA, which was separate from her mother, who was the medical POA.
Right, different roles.
And she was pleading with him, basically begging him to consider transferring Memom down to Florida. They were looking at AARP data on how different states were handling COVID and long-term care, death rates, visitation policies. The source points out a stark difference. Florida's rate was 0.44 deaths per 100 residents, while Delaware's was 1.02.
Wow, more than double. So moving her felt like it might actually be safer.
That was the hope. And you have to remember, Memom went into assisted living for the social life, for the independence. The isolation had taken all of that away.
Such a tragic irony.
It really is. And the book gives these poignant glimpses into her life before the worst of the isolation hit through her old journals. She journaled daily until 2017. She wrote about fun things, winning bingo. But she also noted times when help with showers was late. And showers were already limited to just twice a week.
Only twice a week.
That's what the journals apparently indicated. Or times help with getting dressed was late, making her rush. Small things, maybe, but they hint that issues with staffing or timeliness might have been there even before the pandemic, just amplified everything.
Okay, so let's turn to the most difficult part of this story, the part focusing on that foot wound.
Yeah.
The book lays out a really critical timeline.
Yes. It starts September 25th, 2020. A facility nurse notes redness and shearing to bilateral big toes. But Memom's mother, the medical POA, isn't told.
Not notified.
Now for a brief announcement from our sponsor.
Calling all aspiring authors. Ever wonder why some books fly off the shelves while others collect dust? The secret isn't just great writing, it's having a powerful author platform. And now, Defiance Press brings you the author training program. No push-ups required. 10 days. Daily lessons. Your pace. Transform your author journey and boost your book sales with expert guidance on building your platform. Ready to turn readers into superfans? Join the Defiance Press author training program today. Visit bit.ly/DefianceEP and enroll today. Your readers are waiting. Defiance Press author training program, because great books deserve to be discovered.
Now back to our deep dive discussion.
About an injury.
Not according to the records and the family's account. Subsequent notes are brief. Just says she was seen by an external agency, but no details on care or what they found. She even went to the dentist in October, but still no specific podiatrist appointment was made for this ongoing foot issue.
Then things get worse.
October 14th. Notes mention increased sleepiness, agitation. They test her for a UTI, it comes back negative. The notes say, POA notified. But the source highlights confusion here. Staff seem to mix up the medical POA, Memom's mom, with the legal POA, her brother, so it's unclear who, if anyone, was actually told.
Okay, that's a big communication gap.
Huge. And just 8 days after that negative UTI test, the nurse's notes become alarming. Bilateral great toes infected. Bloody sanguine discharge from tips of toe.
No, infected discharge. That sounds serious.
Extremely. And still, critically, no call was made to Memom's mother or brother about this infection. A request finally goes to the external agency to evaluate and treat pressure wounds, but still no podiatrist is brought in.
They start antibiotics.
Yes, October 23rd. Antibiotics continue into November. But no doctor ever physically comes to assess or treat that wound directly.
And meanwhile, Memom is falling.
Daily falls recorded November 8th through 11th. No injury noted from those falls, and the notes claim family and doctor notified, but again it's vague who exactly was told. The source raises the possibility that this worsening infection could have been affecting her balance, her ability to walk safely, contributing to these falls, but no one seemed to connect those dots or follow up.
Just documenting falls without investigating the cause.
Seems that way. Then the wound description escalates dramatically. November 17th, 2020, the notes state her toe was warm to touch, red raw, and black Escher.
Black Escher, what does that mean?
The source explains that Escher, that dead tissue, typically signals a stage 3 or even stage 4 pressure injury, a very serious wound.
And this is critical because...
Because, according to the book, that facility was not licensed to treat wounds beyond stage 2 without getting a specific waiver and agreement from both the family and the physician.
Which they didn't have.
Which they did not have. And on that same day, an external agency nurse who saw Memom reportedly told the facility staff point blank, she needs to go to the emergency room for this wound now.
Okay, so an internal professional says ER. What happens?
Memom's mother finally gets a call from the facility nurse that day. The first notification about how bad the wound really was. She was understandably shocked.
Of course.
But then, just a few hours later, the same facility nurse calls Memom's mother back and tells her they decided they don't need to send her to the ER after all.
Wait, well, why?
The reason isn't clear from the source, but the family at that moment actually felt relieved, ironically, because they were so terrified of her catching COVID if she went to the hospital.
Oh, I can understand that fear, but...
But, as the author reflects later, if they had truly understood what a stage 3 or 4 wound meant, and that the facility wasn't legally supposed to be treating it, they would have absolutely pushed back. They would have demanded she go to the ER.
That disconnect is just staggering. The facility knows it's severe, knows they can't treat it properly, is told she needs the ER, but then reassures the family it's okay not to go. That insight about relying solely on facility communication when you're locked out, it's chilling.
It really is, and the communication problems just kept snowballing. November 24th, the notes say POA Audrey was notified of a wound care plan. Audrey wasn't the medical POA or the legal POA.
So notifying the wrong person again.
Seems so. And that same day, November 24th, was the only day the author was allowed inside the facility for a visit during this whole period. But despite this escalating wound crisis, nobody mentioned the severity of the situation to her.
Unbelievable. What did she see during that visit?
She described seeing fear in Memom's eyes. That Memom barely spoke. It sounds heartbreaking.
And the final visit?
December 1st. That was the day it ended with staff yelling at the author on the porch because they found out she had reported the facility's misleading visitation policies to the corporate office.
They yelled at her for complaining.
Yes. And after that, no more family visits were allowed while Memom was still alive.
So she's isolated, she's declining. She has this horrific wound they aren't treating properly, and now the family is completely shut out after trying to advocate for her. It's a nightmare scenario.
It truly is. The tragedy reached its peak when Memom was finally admitted to Kent General Hospital on February 2nd, 2021. The diagnosis, sepsis, and MRSA. Life-threatening infections caused directly by that neglected foot wound. Hospital records apparently noted the wound was beyond their level of care.
Meaning beyond the assisted living facility's level of care.
Exactly. And get this, facility records from January 19th, weeks before she was hospitalized, had already noted tunneling and pustulate discharge from the wound.
Tunneling, like the wound was getting deeper.
Yeah.
And pus.
Yes, indicating a very severe progressing infection. Yet, still no notification to Memom's mother, the medical POA, and no change in treatment by the facility.
Letting it get worse for weeks.
Yeah. The record suggests that. Her final days in the hospital sound incredibly difficult. The source details the family struggled just to get adequate pain management for her, having to specifically ask for morphine on February 14th because none had been given since that Sunday afternoon. An ICU nurse apparently commented initially that Memom seemed relatively healthy otherwise, but the infection, it had just gotten too far.
Mary Claudia Jones Barthelma, Memom, passed away on February 16th, 2021.
She did.
What an absolutely devastating sequence of events. The book describes the aftermath for the family, just overwhelming grief, obviously, but also self-blame, constant tears, finding it hard to face people.
Yeah, that raw grief. But alongside it, this burning need for answers about all the unknowns, all the failures that led to her suffering and ultimately her death.
And that need for answers, that grief, it turned into action.
It absolutely did. It became the driving force. Even while Memom was still in the hospital, on February 5th, 2021, the author filed a formal complaint with the state's Department of Health and Social Services, DHSS. It was after she finally saw Memom's hospital record, saw a picture of the wound. The severity was undeniable then.
Did the state respond quickly?
Surprisingly, yes. She got a call back quickly, and an investigation started right away. Initially, the complaint was focused on getting corrective actions so Memom could potentially return safely. But after she passed away, the focus shifted. It became about ensuring a full investigation happened to prevent this from happening to anyone else.
So when the official state investigation report finally came out, what did it actually find?
Well, it did find that the facility failed to follow regulations. That was confirmed. It also noted similar problems in the care of another resident, just referred to as R3 in the report, whose care plan wasn't updated when their condition changed. The report mentioned a pattern of staff not understanding policies needed for resident safety.
Okay, so some failures were identified.
Yes. But according to the source, the investigation seemed limited. Only a small number of resident records were actually reviewed. The report didn't really detail what happened to the other neglected residents, like R3, and it wasn't clear if the staff involved ever got adequate training.
So it didn't get to the root cause.
From the author's perspective, doing that kind of root cause analysis, no. It didn't dig deep enough into why these failures occurred. Was it training frequency, effectiveness, staffing levels? Those questions weren't really answered. But there was some satisfaction, some validation in getting the state to officially confirm that regulations were broken.
An incomplete picture maybe, but validation nonetheless.
Exactly. And we shouldn't forget the context here. Around Christmas 2020, while Memom was isolated and her wound was worsening, that facility had a major COVID outbreak. The book states 26 staff members tested positive, and tragically, 8 residents died from COVID-19.
8 residents died in that outbreak.
Yes. And the author points out this bitter irony. The facility's strict lockdown rules didn't actually prevent this deadly outbreak. Yet those same rules kept Memom's mother from seeing her, supposedly because of the lockdown and the outbreak risk, even though Memom herself never tested positive for COVID.
So the lockdowns failed to protect residents from the virus inside, but succeeded in isolating them from family support outside.
That's a powerful and devastating insight from the source, yes. So, faced with what felt like a limited state investigation, the family knew they had to get Memom's story out more widely.
Trying the media.
Yeah, but initial emails to journalists didn't get much response, and the author hesitated to share on social media. The book talks about feelings of shame, anger, and this fear of judgment. That awful question people might ask, well, why didn't you just take her out?
Oh, that's just victim blaming. It's so much more complicated than that.
It absolutely is. But eventually she felt she had to. She shared Memom's story of neglect on Facebook, specifically asking if anyone had contacts for journalists. She braced for judgment.
And what happened?
Some judgmental comments did come, sadly. But she also got messages from other people sharing their own heartbreaking stories of neglect in facilities. And crucially, someone gave her a contact for an investigative journalist.
Oh, the breakthrough.
Yes. That connection was with Meredith Newman, an investigative journalist at the News Journal in Delaware. The author met with her in October 2021. And when she told Memom's story, she was very careful to emphasize the systemic issues she'd uncovered, not just her personal tragedy. She felt right away that Meredith believed her and was committed to digging deeper.
So the journalist started investigating.
She did, and it was a long, involved process. Meredith started researching, filing Freedom of Information Act requests, FOIA requests to get government documents, which, can take months and often cost money.
Right. Accessing public records isn't always easy or free.
Not at all. But the letters, the reports, the data Meredith uncovered started painting a picture of state oversight failing. of assisted living facilities not really being held accountable. The source connects this to wider national problems, referencing a New York Times article about serious hidden offenses, awful things like sexual assault, residents wandering off and dying that often weren't factored into those public facility rating systems.
So a lack of transparency nationally, not just in this one state.
It seemed that way. Even though assisted living is mostly state-regulated, similar patterns of secrecy and lack of accountability seem to be emerging.
What did Meredith's investigation ultimately reveal in Delaware?
Her work led to this major series in the News Journal. She actually built a database from over 140 state inspection reports, hundreds and hundreds of pages. Her analysis showed the state agency responsible, the Division of Healthcare Quality, had failed to inspect many facilities for years, even before the pandemic hit.
Years without inspections.
Yes, and it showed a high number of reported incidents, falls, medication errors, etc., compared to relatively few official citations or penalties being issued. It raised big questions about whether problems were being properly addressed or maybe even being minimized or removed during some kind of appeal process.
Oh, wow. So infrequent oversight, lots of reported problems, but few official consequences. That definitely sounds like a systemic failure.
Laid bare by the reporting, exactly. And while Meredith kept attending state oversight meetings to understand the system, the author eventually stopped going herself around March 2022. The book explains it just took too heavy an emotional toll. She described it as pouring out her heart, begging for changes, only to hear excuses about staffing or funding. So she shifted her focus to supporting Meredith's work and her own professional life.
That's understandable. You have to protect your own well-being while fighting these battles.
Absolutely. And Meredith kept digging, connecting with other families, publishing their stories too. Stories that showed Memom's experience wasn't unique, like the tragic story of Larissa Stewart, a resident who went missing from a supposedly secured dementia unit and was found dead after falling 3 stories. These stories together built an undeniable case.
Then finally, Memom's story hits the front page.
April 16th, 2023. Almost a year and a half after that first meeting with Meredith. Front page of the News Journal. The headline was stark. She was a geriatric nurse. Why did it take Delaware so long to realize she was neglected?
Powerful headline.
It really was. The article laid out the whole sequence of events leading to Memom's death. It highlighted other problems found at her specific facility, like being cited for neglecting COVID residents just a month before Memom went to the hospital, or another resident with dementia found wandering on the street outside in July 2021. And it placed it in context, pointing out these decade-long struggles families face getting complaints investigated. It even quoted a former director of the State Oversight Division from way back in 2013, admitting they were underfunded and had a 2-year backlog even then.
So the article validated not just the family's experience, but showed it was part of this much bigger, long-standing pattern of systemic failure.
Exactly. That validation was huge. Seeing multiple articles come out in the spring of 2023, it confirmed the systemic issues were real, but it was also overwhelming to see how deep and persistent they were. Still, there was this flicker of hope. Maybe this media exposure would finally force the conversations needed, demand action.
And this momentum, this public awareness, led to forming an advocacy group.
It did. In May 2023, a Facebook page started called Families for Community First Choice. The initial idea was mostly about sharing info on home-based care options, kind of using the newspaper stories as a warning about facility neglect. The underlying belief was that avoiding institutions altogether was the safest bet for seniors.
Trying to keep people home if possible.
Right. But it quickly grew beyond that. It formalized into the Delaware Elder Care Advocacy Coalition, founded by families, like Memoms, who had been directly impacted by neglect, harm, or loss in facilities. Their mission became broader. Honor their loved ones, yes, but also protect current residents and push for real, impactful legislation.
So a two-pronged approach.
Exactly. Advocating for better home and community-based care options and working to improve care inside facilities, pushing for transparency, accountability, aiming for best-in-class care standards. They also had this interesting idea that creating strong competition from home care options might actually incentivize facilities to improve their own quality.
Using market forces, in a way.
Kind of, and the book mentions this frustration with the usual state meetings, where you only get maybe 2 minutes for public comment. The coalition wanted to be seen differently, not just as people sharing sad stories, but as partners ready to work on concrete solutions.
That's a smart strategy. Bringing solutions, not just grievances. What kind of solutions were they looking into?
Well, the author's mother really dug into policy research. She focused on a federal program called Community First Choice, or CFC. It's actually part of the Affordable Care Act from 2010. It gives states an option to provide more home and community-based services to people eligible for Medicaid, helping them stay out of nursing homes. And if states opt in, they get an extra 6% federal funding match for those services.
So more federal money to help people stay home. What kind of services?
The book lists examples like attendant care, help with daily living, delivered meals, those personal emergency response buttons, adult day programs, respite care for family caregivers, even home modifications like ramps or grab bars.
Sounds comprehensive.
Yeah.
How many states use this?
According to the source, as of October 2023, only 9 states had actually opted into this CFC program. They cited info from Texas, one of the states that uses it, saying it prevents enrollees from needing to move. And a Johns Hopkins study found it was financially feasible and supported a more equitable approach to care.
So advocating for Delaware to adopt this kind of program.
That became a key goal. And the coalition started taking these ideas, along with their personal stories, into the legislative arena. They started attending meetings, like one task force on enhancing lifelong community supports. The author noted she was often the only person in those meetings consistently speaking up about the specific needs of seniors.
That's revealing in itself, isn't it? How seniors might get overlooked in broader discussions.
It really is. So the coalition got more organized, developed a formal proposal, and then a big break came in December 2023. They were invited to meet directly with key state legislators, Senator Monsavinos and Representative Johnson. They were asked to basically be the point people representing families affected by these issues.
Wow, a seat at the table?
A real opportunity. The coalition committed to providing input, including specific ideas for improving the DHSS website, making facility information, inspection reports, complaint data much more transparent and accessible to the public. The book captures this feeling of cautious optimism, maybe mixed with a bit of meeting fatigue from past efforts that didn't go anywhere. But this felt different. Their proposal really hammered on requiring specific, trackable metrics for transparency, especially pushing for assisted living and memory care facilities to report data just like nursing homes already have to do federally.
Leveling the playing field for transparency. Makes sense. So 2024 becomes a critical legislative session.
Absolutely pivotal. And the timing was interesting because national attention on these issues was also growing. There was a U.S. Senate Special Committee on Aging hearing in January 2024, the first one focused on assisted living in 20 years.
20 years, wow.
Yeah. And it was partly prompted by media coverage, like a big Washington Post article in December 2023. That article highlighted horrific incidents, a resident dying in Colorado after banging on locked doors in the cold, the fact that nationwide, over 2,000 residents had wandered away unsupervised since 2018, leading to 98 deaths. And it specifically mentioned a Delaware resident among those cases.
Just awful story.
Truly awful. And that article also connected these quality failures back to the industry's business model, the focus on profits. It mentioned a 2008 law allowing investors to own these properties tax-free and take a slice of the income, averaging like a 9% return, much higher than typical real estate.
So the local fight in Delaware was happening against this backdrop of growing national awareness about profits potentially trumping care quality.
Exactly. And riding that wave, a package of 4 bills aimed at long-term care reform was introduced in Delaware in February 2024. That package eventually grew to 5 bills, all of which were ultimately passed.
5 bills passed. Okay, let's quickly break down what each one aimed to do based on the book's account.
Okay, first up, workforce. Senate Bill 217. This created a loan-to-grant incentive program to encourage nurses to work in long-term care settings. The coalition strongly supported this. They saw the direct link between adequate, stable staffing and quality of care. The book cites studies backing that up. And, it resonated personally, thinking of Memom's own passion for nursing.
Right. Addressing the staffing crisis is fundamental. What about dementia care? That seems like a huge area of need.
2 bills focused on that. Senate Bill 150 originally aimed to significantly boost dementia training requirements, like 12 hours initially, and even define dementia care in state law, which Delaware apparently lacked. The coalition pushed hard for this, pointing out the incredibly high cost of memory care, sometimes $16,000 a month out of pocket, often without any guarantee of specialized staff training. They used Alzheimer's Association data showing training benefits everyone and compared Delaware's situation unfavorably to states with lower costs but higher training mandates like Alabama or Arizona.
So what happened with that bill?
Well, there was pushback from the industry during negotiations. The final version got amended. It ended up applying only to assisted living facilities, not all long-term care. The specific 12-hour training requirement was removed and replaced with vaguer language about sufficient staff training. the source doesn't specify if any minimum hours remained in the final text. And the legal definition of dementia care, that didn't make it into the code.
So some progress on training awareness, maybe, but watered down from the initial goal. What was the other dementia bill?
That was Senate Bill 151, focused on dementia disclosure. This requires facilities that market themselves as providing dementia care to explicitly disclose what services they actually offer, what their staff training plan is, and any extra fees involved. The coalition saw this as vital for transparency, empowering consumers, right? Letting families compare facilities accurately, know what they're paying for, avoiding those surprise fees or incorrect assumptions about training. They pointed to Texas, which passed a similar disclosure law back in 2015.
Makes total sense. Transparency for consumers. Any changes to that one?
Yeah. Yes, one significant amendment during negotiations. The requirement to post this disclosure information publicly on the facility's website was removed. Instead, the disclosure has to be provided directly to the family upon admission or request, and also filed with DHSS.
Okay, so families can get the info, but it's not as easily accessible for comparison shopping online.
Correct. The book includes this really powerful moment from the negotiations, though. A coalition member shared the deeply personal story of how her mother died after a fall in a supposedly secured dementia unit, really driving home why clear disclosure about what secured means, what the staffing is, what the protocols are, is so critical.
Wow. Using personal stories to impact policy negotiation. That takes courage.
It really does. Okay, next bill, House Bill 204. This one dealt with oversight of temporary staffing agencies, the agencies that supply fill-in nurses and aides. The coalition backed this too. They linked it to the huge problem of high staff turnover in the industry, averaging around 52%. When turnover is that high, facilities rely heavily on temporary staff.
Right, the agency staff.
Exactly. The book mentions common reasons for turnover pay, workload, lack of training, poor management. The argument was that if you're relying on agency staff, the state needs to have some oversight over those agencies themselves, ensuring proper vetting and standards. It's a step towards safer care for everyone.
Yeah, that seems logical. Ensuring quality control for temporary workers, too. What was the last bill?
The fifth one was Senate Bill 215, tackling facility survey frequency and oversight. Basically inspections. It changed the old standard, which was just regular inspections, to annual. Then it was amended slightly to annual, but no longer than 15 months apart to match the federal rules for nursing homes. But this new state rule applies to all long-term care facilities, including assisted living.
So guaranteed inspections at least roughly every year for everyone.
Yes. The coalition framed this as an issue of quality and fiscal responsibility. The source mentions budget hearings where huge sums like $40 million in state and federal money over 2 years were being invested in long-term care. But there were questions about where that money was really going. Was it reaching frontline staff as raises or just lining pockets? The coalition argued that the cost of doing regular, thorough surveys is minuscule compared to that investment, and those surveys are essential to ensure the money translates into safe care. They also pointed out the strain the same state surveyors were juggling this and a backlog of applications for home health care agencies.
That's a strong argument. If taxpayers are investing millions, basic oversight to ensure safety seems like a minimum requirement.
Exactly their point. So navigating this whole legislative process, it involved a lot. Attending hearings, writing testimony, facing down opposition from industry lobbyists. The author shares moments of doubt, but also finding strength in unexpected places, like seeing license plates in the parking lot that said, "No bull," or "His will" on tough days, taking them as little signs to keep going.
Those little things can make a difference when you're in the thick of it. The book also mentions they reached out to someone in the industry.
Yeah, that was interesting. The author contacted the director of a successful accredited assisted living facility out in Missouri, someone known for high quality. She wanted his perspective. He talked about how accreditation actually benefited his business. Better training, fewer falls, better staff retention, happier residents, and yes, even better profits.
Yeah.
He apparently quoted Proverbs, something like, "The wicked flee when no one pursues, but the righteous are bold as a lion," maybe hinting that those who resist transparency might have reasons to.
Using the Bible against the opposition.
Well, sharing his perspective with legislators certainly offered a counter-narrative. It showed that high-quality care and running a successful business can go together, challenging the idea that regulations only hurt the bottom line.
That's a crucial point. Quality can be good business.
Absolutely. And all this effort, the years of grief turned into research, the media investigation, building the coalition, the direct legislative advocacy, armed with facts and personal stories like Memoms, strategically presented it all culminated in these significant victories. The successful passage of those 5 bills in 2024, all aimed at improving elder care in Delaware.
That really is a remarkable achievement, especially considering where they started and the systemic obstacles you've laid out.
It truly is, and the source is clear. It acknowledges how hard-won these victories were, but it also stresses, these bills are just the beginning. They're important steps, definitely, but they don't magically fix all the deep-seated systemic problems overnight.
Right. Passing a law is step 1, making it work is step 2. Implementation, enforcement. That's where the rubber meets the road.
Exactly. Now the state agencies have to actually develop the detailed regulations to put these laws into practice. And then comes the ongoing challenge of ensuring consistent, meaningful enforcement. The book really emphasizes that these are complex systems. They require continuous monitoring, continuous improvement. The advocacy doesn't stop just because a bill is signed.
What this whole journey powerfully demonstrates, though, is the impact that dedicated, passionate advocates can have, especially when they band together.
Oh, absolutely. The power of even a small group of determined people, armed with facts, driven by personal experience, united in their cause, it should never be underestimated. They proved that change, even incremental change within these really complicated systems, is possible.
And the book keeps coming back to that idea of home-based care being a critical part of the overall solution, doesn't it?
Yes, very much so. There's this strong conviction woven through the narrative that most people, if given the choice, want to age in their own homes. And society needs to shift resources and priorities to make that a realistic option for more people. Expanding home and community-based care isn't just about individual preference. It can also reduce the pressure on and reliance on institutional settings. The source suggests a broader societal shift is needed, really redesigning how we view and support our elders, moving away from institutionalization as the default.
Empowering people to age with dignity where they choose. So if we were to boil it down, what were the key strategies the book highlights that made this advocacy effort successful?
The author reflects on this and summarizes 3 core strategies they used effectively. First, develop a clear plan, almost like a business plan. Have specific objectives. And importantly, model your proposals on best practices that have worked elsewhere, using data from other states or industries.
Okay, plan with objectives based on evidence.
Yeah.
What's second?
Second, build a network of allies. This was crucial. Connecting with the media, especially Meredith Newman, was pivotal. Finding other families with similar experiences, engaging supportive legislators. There's power in numbers and diverse expertise.
Allies are key. And third,
anticipate opponent arguments and be ready with facts. Know who is likely to push back against change, understand their arguments, and do your homework. Research the data, find the counter-arguments, be prepared to address concerns with solid evidence.
plan, allies, and facts to counter opposition. That's a powerful playbook for advocacy.
It really is. And ultimately, the coalition sees this work as honoring Memom's legacy. Her story alone, heartbreaking as it was, wasn't enough at first. But using her story combined with rigorous data, strategic planning, and that powerful network of allies, that's what made the difference. And their ongoing desire, as mentioned in the book, is to partner with all stakeholders moving forward, because they fundamentally believe that aging with dignity isn't some luxury, it's a basic human right for everyone.
So we've followed this journey, haven't we? Starting from the unimaginable heartbreak of neglect in an assisted living facility, transformed into this incredibly powerful advocacy movement, a movement that actually achieved real legislative victories aimed at improving elder care.
Yeah, this deep dive, it really hammers home how critically important it is for all of us to understand the systems of care, or sometimes lack of care, for our aging population. It's such a powerful illustration of the difference that vigilance can make, demanding transparency, demanding accountability, and just sheer dedicated advocacy. It's not just about one family's profound loss. It impacts potentially thousands of seniors and their families trying to navigate these incredibly complex, often opaque systems.
Absolutely. And considering the systemic failures this story brought to light, and thinking about the hard-won legislative steps they've now taken, it makes you wonder, doesn't it? What further innovations are really needed? Maybe it's in technology ways to enhance remote monitoring or communication. Maybe it's about finally figuring out how to truly support and retain the dedicated workforce these facilities so desperately need. Or maybe it's even bigger, like rethinking community design to better support aging in place. What's truly essential to ensure every single senior, whether they're aging at home or in a facility, can live and age with the dignity and the safety they absolutely deserve.
Thank you for joining us on this deep dive into Candace Esham's Locked Out. You can order Locked Out right now online at Amazon.com. Please visit Defiance Press and Publishing at www.defiancepress.com for more amazing titles. If you would like for Defiance Press to consider your manuscript, we would love to review it.